Good morning, everybody, and welcome to Certipay's Coffee Break number 15. I am your host, Rachel Camella, and I'm here with our moderator, Cindy Merkel, and also I see a few other members from the Certipay HR team on the line. We've got Claire and Kathy and Janet and a couple other people on the line. Welcome, everybody. I am drinking a Dharma espresso this morning. It is wonderful, and I made it as an Americano, so I hope you guys all have great coffee. Cindy, what do you have?
I already finished my standard dark roast with 2 shots of espresso.
Yum. Can't go wrong with that. Okay, so today we are talking about employee assistance programs and why it's something that you should really consider implementing at this point if you don't already have one. And if you do have one in place, we'll give you some tips and tricks on how to maximize. So first, I want to say, before the pandemic hit, your employees were dealing with quite a few just normal things that created a lot of stress. So family conflicts, financial legal issues, perhaps alcohol or substance problems or issues, loss or grief, all of these things, life changes, a birth or a death, many different things create stress in your employee's life, and all different types of emotional stress. So these things were in place before. So now let's throw 2020 at that. And we've got a whole new list. Now, these things didn't replace the things that were occurring before. They are in addition to. So you can imagine the stress levels that most people are experiencing. I think most of us are probably going to have a little PTSD when we get on the other side of this year. And that's not a joke or taken lightly. This is really a year that's going to have an impact. Most of us are going to remember this year for a long time. So caring for a parent, many people have actually taken their elderly parents out of assisted living facilities or elder care facilities because they're fearful of the COVID situation in those places. So now they're juggling caring for an older parent when perhaps they had a solution for it. Childcare issues. We still have schools closed, daycare centers closed, childcare issues, people who would normally be caring for children who can't. So this is a big issue. And then throw on top of that, is my school open? Is my school not open? Do we have to go in person? Do we set up a remote scenario? These are big issues for parents. Financial stress. Perhaps one of the working adults in the household has lost their income. Perhaps they've worked 15 years on a small business endeavor and they've lost the business. So financial issues are extreme this year. Maybe even illness. So many of us have had to deal with somebody who has COVID or has had to deal with the COVID illness firsthand. And that creates a lot of stress because now you have all the layers that go with that. It goes without saying that we are in a very unique, polarizing political climate, and many of your employees may be dealing with extreme stress or conversations that are political in nature at home. And they never had to do that before. And so that is a situation that's happening in your employee's environment. And what our personal viewpoints are doesn't really matter. What matters is that we understand many of our employees are experiencing some extreme stress right now as a result of our political or social climate. And finally, loneliness and isolation are a very big deal. We have seen an increase in suicides, an increase in antidepressant prescription medication, and the loneliness and isolation that we've seen specifically this year as a result of some of our pandemic requirements has created a much higher level of stress than we've seen in past years. So, and again, I want to say these are not things that replace the things we were dealing with before. These are in addition to. So it makes it really a unique kind of year. So having that as the intro, let's talk about what an employee assistance program can do. An EAP, you may have already added one, you may have already heard about it, but I really want to kind of talk about some of these important benefits. Encouraging a positive work environment. So when we talk about this, when people are stressed, the absenteeism goes up, there's a decrease in performance, there's an increase in health problems. And so if you can do things that minimize those kinds of stress levels, then that improves your work environment. And it can provide an outlet. So if you've got a person who's stressed, that individual at work is not going to be as engaged. They're not going to be, that person could even potentially create violence in the workplace or a bullying situation. If you've got people who are upset, it upsets the other people. And so when you find an outlet for that, and an EAP can be a great outlet for that, if you can get those individuals calmed down, then it helps to create a better environment for everybody. Productivity. This is a good one because we have some hard numbers on this. We have some facts that really give us some information. According to SHRM, we have seen companies lose 36% productivity due to absences. And then we know when we add an EAP program, we see 33% less sick time used. So that's kind of a big deal because if you've got people who you can get them to use the EAP, we know they're not going to use as much sick time. And just so you know, COVID aside, people don't really call in when they're sick. They call in when they're sick of it. And that's the number. Those people that are calling in because they are sick of it or they need to catch their breath, those are the people that you're going to calm down. And they're not going to call in sick. They're not going to need to. And so that's a big difference, that 33%. 40% less in time lost. So this is the people at work that are meandering around, or they're walking in the hall, or they're sitting at their desk semi-paralyzed because they can't really function. You know, you lose a lot of time in the day because people are distracted and they can't focus. You know, if people are distracted, they're less motivated, they're less creative, they're not going to follow what their normal goals would be in the day. And this is a big one, 65% reduction in work-related accidents. And that is directly connected to adding an EAP program. So who wouldn't take those numbers? I mean, these are big numbers that make a big difference when it comes to productivity in the workplace. So you have somebody who's distracted and not paying attention, they're that much more likely to end up in a work-related accident of some type or create an accident for somebody else. So when you get people kind of, you know, drilled down and focused, and you help them clear their minds and you help them take a deep breath in whatever way it is through an EAP, then you get all that productivity time back. It's very valuable. So what is the cost? It's not very expensive at all. For a couple of dollars per employee per month, which is a fraction of what your health insurance costs are, if you add this in, then you make a big difference because you change all these things. And when I talk about the return on investment, the low number is 8 to 1. So for every dollar you spend on an employee assistance program, you're going to get it back 8 times. And because of all these things that I listed, you're going to get those productivity hours back, and you're going to have a better work environment. You're also going to have people calling and using your EAP instead of going to a healthcare provider or going to a mental health provider. And they may ultimately use those things as well, but this is going to really decrease the usage. And then in turn from there, you're reducing the healthcare costs because when you get to your renewal, you didn't have as much usage on your plan because people were feeling better and doing better. So all of these things add up. 8 to 1 is a low estimate. I suspect these numbers, because of all the soft dollars that you see from the other productivity numbers, that's a much higher return. So don't be afraid to spend a little money on this, because you're going to get it back at least 8 times. Retention is the final benefit that I wanted to talk about, because turnover is so expensive. We know that. Turnover can cost you 3 times somebody's wages. And if you create a positive environment, happy people stay where they are. And so that's going to make a big difference. And you want to keep the people. If you can reduce your turnover and creating an environment that's positive, and having an outlet for people, and helping to put some effort toward the mental health of your team, you're going to keep those people. They're going to appreciate that you did that. They're going to value the results, and they're going to stay. And that in turn goes back to that ROI. It's going to save you a lot of turnover dollars. And turnover, I mean, we can talk about that in another coffee break. Turnover is really, really expensive. Just to replace a single person, if you're just talking about placing the ad, reviewing resumes, your first number is $5,000 and you didn't even do anything yet. Now you have to replace all of the training hours that you spent on an individual, all the corporate memory lost with the person who leaves, all of the frustration with the other people that had to pick up tasks. I could go on and on, but turnover is very expensive. So if you add this little piece that helps to reduce your turnover numbers, you're really going to win. How are we doing? Are we good so far?
We're good. I have a few questions that we'll address at the end.
Perfect. Okay. So why is it that your employees don't use it? So either if you have it or if you implement it, what's going on in the minds of your team? These are in order. The biggest thing is the stigma. So people immediately think it's a negative, or it's viewed as a weakness, or it's something that will be looked down on. So the stigma of using an EAP traditionally has been very negative. I think it's something that we can change, and that's going to come with communication and education. Next is confidentiality. They don't trust you. They plain and simple, they don't trust you. They think you're trying to get information about them, and you're going to use that information against them down the road. That's what they think. So again, it's important during your information process and your education process to talk about how it has nothing to do with you. It is a third party. It is a totally separate company. You have no access. There's no connection. It doesn't even go through your phone system. You know, it's very important to talk about the layers of confidentiality that are in place for your EAP program and how it isn't you. If they feel like it's part of your company or it's something that you have control over, they will have a lack of trust for that program, and then therefore they won't use it. So really spend some effort on making sure they're aware that it is an extremely confidential process, and it is between them and the person they call from the EAP. So this I thought was interesting. A lot of people don't use it because they think they need to get permission. So they need to get approval from the HR department, or they need to get some special referral code or some kind of permission format. And so it's important also during your education process, you have to make sure they're aware that they don't need permission. They just need to reach out to your EAP provider and go through those channels. There's no other course of action. And we'll talk about that when we talk about educating your team on that. So that's one of the top 3, though, is they don't use it because they think they need to get permission first, and they don't want to do that. Part of that is because of the confidentiality and the stigma. Okay, so now this one, they don't even know you have one. That one's really common too. There might be a lot of people who would use it at your company without thinking twice, but they don't even know you have one in place. So again, information communication, we're going to talk about that next. So the last 2 are lack of understanding and awareness. So lack of understanding on what that EAP can even do for them. So people don't realize how many different types of things the EAP can help them with. They might just need somebody to talk to for 5 minutes. They might need a financial guidance. They might need somebody to help them create a budget. They might need somebody to help them figure out a plan to care for their elderly parent. So there's so many different things an EAP can do, and your team doesn't use it because they aren't aware of what all those pieces are. lack of awareness of even how to use it. So they don't know the email, they don't know the phone number, they don't know how to get in touch with somebody, they don't know the process. So a lot of this stuff, the solutions are information and education. Pretty simple. So what do? I said communication 20 times already. So that is the important thing. And I've seen some of our clients do some really interesting things with the communication piece of this. You can simply add it to your open enrollment platform, send information out with your normal enrollment. Many EAP providers have a canned presentation ready that they can send to you, that you can send on to your team. Several will even come out to your location and give a live presentation to your team. So there are a lot of different ways initially to get some information out. But it will be very important to promote this program year-round. And you see all those savings that we talked about. You see where those dollars come back to you, but it only comes back to you if people use it. So promote it year-round. Send out a monthly email to your team or a text message just to remind you, we have an EAP in place. Here's the number. It's totally confidential. Let us know if you have questions, something like that. Don't be afraid to promote this year-round with, just little touches, a monthly touch and whatnot. Training your managers and your leaders will be very important, and helping them understand all of the components. And so they can talk about it. They can talk about what your EAP does for people, how it can be useful. But also, you want to train your managers so they understand some signs. If they hear certain buzzwords from employees, or if they hear certain conversations or certain complaints or issues, it will be important for your managers to understand what those comments can mean. And so when they hear certain things, it might trigger to them, okay, I need to offer this person our EAP contact information, or I should send a reminder to the team about our EAP. So training your managers, giving your managers information and guidance on how to handle your EAP program will be very useful. Because they can, yeah.
I was just going to say, one way to do it without calling somebody out when you notice a behavioral that might be out of character for them. Maybe once a month, just put a piece of paper in their check or hand it out as a newsletter, just as a reminder, so everybody gets the information consistently and no one feels like they're being called out for acting different than they normally would.
Absolutely. That's great advice. And so I'm not saying to call anybody out for sure. What I'm saying is make sure your managers are trained to identify when there's an issue, and that might be a good time to send out that notice to everybody. Or send it out on a regular schedule, like Cindy said, in the payroll cycle, in the pay stubs, the first of the month, whatever it is. It's just important to have your managers trained on the entire process. It will go a long way. Great point, Cindy. So make sure your employees know that it isn't connected to you. Like I said before, it has to be a third party. They have to be aware that it's a third party or they won't trust it. And even that's going to be kind of tough. So same thing, if you send out notices with, for example, the pay cycle or with pay stubs, then if it's on your company's letterhead, that might give them the message that it's your program. So if you make them aware that your third-party provider or the EAP program you have is with this X company, look for a handout coming soon, that kind of thing. Just make sure they're aware that your plan is with this third-party provider so they understand there's some layers between them and the company. And signage, don't just hang up your sign one time by the time clock. It's good to have posters in the break room, but don't be afraid to do other things too. Send out electronic messages, emails, group texts that go to multiple places, any kind of electronic messaging that you have. If you have an intranet system within your company, that's a good place to do it so that you can do it consistently and uniformly across the company. Confidentiality, I think I've stressed enough. It's very, very important. People feel like the information could be used against them. So they really need to feel like it won't go anywhere. As soon as they reach out, nobody will know. That information won't go anywhere. It won't be used against them. It's strictly there to make them better and to help. So that's one of our important components. So how can you add one? And again, if you don't have one in place, these are some of the things you can do if you want to add one in. If you already have one in place, educate yourself. Reach out to wherever that came from, your provider, and get some additional information that will help you implement your program to maximize. So the first thing you might do is check with your payroll provider and see if this is something they can add for you. Your insurance broker can definitely help you in this category. Oftentimes your healthcare provider will have an EAP in place, and they're sometimes limited. So if you find that your healthcare provider has one included in your platform, ask exactly what's included in that layer, because the EAPs that are typically connected to your healthcare provider are going to be somewhat limited. So, and they may not be. They may be full service EAPs. Just find out for sure before you lean too heavily on it. And they may even have an upgrade level available. So ask some questions there if you're not sure. And finally, your work comp carrier, again, another place that can help you. Obviously, when we see numbers like a 65% reduction in workplace accidents, your work comp carrier would be thrilled to add an EAP for you. So all of these places are places you can look if you don't already have one. So my final thoughts, if you don't have one in place, please get one. It is well worth it. It will pay for itself 8 times over pretty quickly. And if you have one in place, educate your managers, educate your employees, communicate with your team, make sure everybody is aware of exactly the platform you have, how to use it, how to access it. Education is very important. And finally, be compassionate right now. These are really tough times, and you have employees who are suffering in some way. So a little bit of compassion from you will go a long way in improving your business, improving the workplace that you have, and improving your workforce. So I hope this has helped, and I'd love to hear your questions.
Okay, Rachel, the first one is they currently have 2 EAP programs. One is through their short-term disability administrator, and one is through their health care, but it's only for people who are signed up for the programs. The question is, which one should they use? But to parlay off of what you said, and for the next question, does it have to be a part of your health care? For example, do I have to be signed up with the health care to use it? Can there be an outside one? For example, like you mentioned with the workers' comp, that I don't have to have health insurance to utilize the program.
Yeah, all great points to bring up. So let's speak to this. So if you have one that's tied to your healthcare or tied to your short-term disability platform, they're probably a limited plan if they're connected with that. And when you know you have a robust EAP, it's when you paid for a separate platform. And that's what I'm talking about, that $1.50 to $5 per employee per month. That is a very specific EAP platform that you add, and it's added for everybody. So people do not have to be on your healthcare plan to get to be included in your EAP platform. And the way they typically work is you say, I have 50 employees, and so the EAP will say, okay, your monthly number is going to be blah. You don't even have to enter in each individual employee. It's just coverage for your business for any employees you have, whether you add to your team or people leave, it's that same number. They're all covered under an EAP when you add it. And so it sounds like under these 2 plans, they're included in the benefit that you have, but they're probably limited. So I would start by finding out exactly what level of coverage do those 2 things have. And then consider maybe upgrading to one that includes all employees and not just ones that have those plans. And also inform your employees. So the people that have your health plan may not know they also have an EAP included in their health plan. But my guess is those are probably somewhat scaled down versions because they're bundled in. And you really want to get one that covers everybody.
The next question is along the same line. Our EAP is for eligible employees only, full-time. Is there a provider out there with an EAP plan for part-time employees, or a plan that is more inclusive, included in this entire staff? Same question, basically.
Yes, and absolutely. There is a plan out there for any kind of combination you want to create. So if you have one exclusively for your full-time employees, you could then either upgrade that same plan to include everybody regardless, or go find a plan that is strictly for part-time employees. But what I would say is why I don't know that eligibility for that being full-time kind of.
My guess is it's tied to their healthcare. Their healthcare.
It's probably tied to the healthcare.
Yeah. They're only eligible. Healthcare is only eligible for full-time.
Right.
For full-time.
Probably, and you might reach out to them and find out, is that something that you added and paid extra for, or is that something that's included in the healthcare? It sounds like that's probably connected to your healthcare plan, in which case it might be a limited platform anyway, so you really want to see if you can get one that includes everybody, all employees, regardless of length of service, connection to healthcare, anything else.
Rachel, just for clarification, that the EAP plan we're just talking about, it's tied to their life insurance plan, which is only eligible to full-time employees. So again, see if you can get a second plan that might work for either everybody or part-time employees only.
Yeah.
Okay.
If they're tied to another platform, they're probably limited. So you want to get something that covers everybody.
Well, I guess in theory, too, you could, obviously the EAP is already a part of either your benefit structure or your life insurance structure. So those are going to stay intact regardless. There's no reason, if it was a reasonable cost, that you couldn't get a plan for everybody, and thus the full-time employee might be eligible for more things than the limited plan under the benefit plan currently offers.
That's right.
Next question is there a list of what services you would recommend that should be included in a good EAP?
That's something that when you start to reach out to do your homework and shop for an EAP, you'll get a list from them. And most of them offer the same kind of benefits. So just take a look at the list and make sure it covers all the things you want to include.
Most of the good plans will have a financial element, and a law element. For example, you can talk to an attorney. Under the financial, it could be help with a bankruptcy, a mental health portion, like Rachel said, home health care, or care for your elderly parents or elderly folks that you're taking care of. Like she said, there's categories, but those are the general ones.
That's right.
That's all the questions I had.
All right, guys. Well, we want all of your employees to be healthy and successful, and we want your businesses to thrive. We know these are definitely interesting times for all of us. And once again, Certipay, thanks you. We appreciate your business. We appreciate you. And we are so glad you share your coffee breaks with us on Thursday. So thanks for joining us, and we will look for you again next week. We've got some more great topics to come. Thank you all.